Thank you, everyone, for joining. Good morning, good afternoon, and good evening, depending on wherever you are joining from. Welcome to our second session of the DNO Sub-Community of Practice. And this is a sub-community of practice that we have intended to promote our data-driven investments for effective laboratory network optimization, where we gather all the country teams to come here and share the issues that we have, the challenges, best practices that we use to optimize our diagnostic network. To move on, in today's session, we have brought the Global Fund to provide an overview of what the funding cycle is currently, what are the priorities for involvement of laboratory directorates in preparing for funding requests. We realize this is not, the involvement is not the same everywhere. And to come to the subject of this sub-community of practice, what funding is available on diagnostic network optimization from the Global Fund perspective, and how can we plan for DNO life cycles across the funding cycles that are coming. And in addition, we will also use the experiences from Gabon in terms of how they have conducted the basic analysis of their TB GeneXpert laboratory networks, providing instances of how they have used that to scale up the capacity for COVID-19 testing as part of their Global Fund investments in the C19 RM grants. This will be an hour-long session, as usual, that will start with the two presentations, followed by a Q&A. To take us through these presentations, we have Patrick Royal, who will give us the first presentation. Mr. Patrick is currently the project manager for the ongoing Lab Systems and Health Security Strategic Initiative, which runs from 2020 to 2023 within the Global Fund RSSH Lab team. Through the Lab Strategic Initiative, Patrick supports 27 countries in adoption and scaling up complex interventions to advance laboratory systems, maturity and readiness. Before he joined his current role, Patrick held a role as cost-efficient advisor in the office of the Global Fund CFO, where he was investigating innovative contracting and market-shaping opportunities for diagnostics and laboratory commodities. Before then, before joining the Global Fund, he had worked in various pharmaceutical governance and regulatory roles at Novartis and GlaxoSmith, including working as a Pulse Fellow, supporting PATH for the development of their 5-year strategic plan on AMR in the offices that are in Geneva and Hanoi. Patrick will be joined by Ms. Mbenga Roque from the Gabon National TB program, where she joined in 2017 and appointed as the focal person for the TB laboratory services. She has supported the extension of the National TB Laboratory Service in Gabon, including capacity for molecular testing within the GeneXpert TB network. Mrs. Mbenga also supported the laboratory pillar for Gabon COVID-19 Response Committee as a country coordinator for the Africa CDC and ASLM COVID-19 response and the Step Up Project COVID-19 testing project as well. So, ladies and gentlemen, I invite you to sit back and then we listen to the two presentations. Over to you, Patrick.
Thank you very much, Anafi, for that introduction. And I'd like to thank ASLM for providing this forum to share information and insight on Global Fund's priorities and our renewed commitment to supporting key stakeholders as we pursue our shared ambition to defeat HIV, TB, and malaria, and ensure a healthier, safer, more equitable future for all. I'd also like to thank all of you who are involved for your engagement with the Global Fund as we prepare for our next funding cycle, 2024 to 2026, the planning of which has already begun in the last few weeks. This year, the Global Fund celebrates two key milestones: 20 years of impact against HIV, TB, malaria, and additionally COVID, as well as a record-setting replenishment conference concluded last month in New York, during which the Global Fund raised $15.7 billion as a record to continue supporting the ambitious goals of countries within our scope, that's 120 countries, over the next 3-year period to assist in their fight against HIV, TB, malaria, and strengthen the health systems. As we scale support towards the next funding cycle, starting in 2024, the Global Fund is also implementing a new strategy. Our primary goal, as shown on screen, is to end AIDS, TB, and malaria by working with and serving the health needs of people and communities. Most relevant to lab system strengthening are the first contributory objective, maximizing people-centered integrated systems for health service to deliver impact, resilience, and sustainability, and the evolving objective at the bottom of the screen, contributing to pandemic preparedness and response. For those of you who are familiar with the Global Fund strategy or who were involved in the strategy process, will be familiar with the previous strategy and will note that there are some critical changes in the current strategy. There are much greater emphasis on data-driven decision-making, investing in systems and capabilities that enable rapid generation, analysis, and use of high-quality data. And second, there's a much greater focus on accelerating equitable deployment of and access to innovations, addressing bottlenecks to deploy resources to those in need. In the scope of our new strategy, increased attention is now being given to lab system strengthening, with increased recognition of the critical role that lab systems play in delivering on impact against HIV, TB, malaria, and priority diseases. COVID-19, in addition, has had a marked effect on the realities of our response to priority diseases and the way we all support health systems. There is a greater recognition that labs are the foundational mechanism to disease response, that the lab system needs to be well-resourced, not just with diagnostic analyzers and equipment, but also with human resources and supportive systems. And finally, that investments in the laboratory system benefit our fight against the key diseases far beyond HIV, TB, and malaria, as they contribute to our capacity to detect pathogens of pandemic potential and respond to those threats. Global Fund's operating model runs on a 3-year rolling basis. At present, in 2022, we're 2 years into the 3-year funding period, with grant implementation ongoing. Countries that are within scope of Global Fund's funding are eligible for an allocation to each of those 3 diseases, HIV, TB, and malaria. Through the country coordinating mechanism, the stakeholders discuss program split during the country dialogue, in which they define how much they intend to spend across each of the grants, as well as for horizontal investments under RSSH, Resilient and Sustainable Systems for Health. There is no specific funding mechanism in order to provide discrete funding to RSSH. However, countries may so choose to invest horizontally through the RSSH grants. These are called components in Global Fund's terminology. Funding requests should be aligned with national strategies. Most relevant to us in lab system strengthening is the National Laboratory Strategic Plan, defining the key priorities that the country is intending to confront. Each request for funding submitted to the Global Fund is evaluated for technical merit and strategic focus by an independent group of experts called the Technical Review Panel. This is the second stage of having submitted a funding request. Preparation of funding requests is undertaken through a consultative process hosted by the country coordinating mechanism. And during this process, it's critical that lab stakeholders seek active involvement to advocate for and secure support to cross-cutting horizontal investments in the laboratory system. The focus of our approach in investing in lab systems at the Global Fund is guided by 4 key principles. First, empowering and activating lab leaders to advance integrated approaches. Second, supporting decentralization of patient-centered service delivery. Third, coordinating and consolidating system resources and supportive processes. And fourth, securing value for money and encouraging cost efficiencies. These 4 principles point to integrated laboratory systems as the most vital mechanism to improving accessibility, quality, timeliness, and cost efficiency of diagnostic and laboratory services. Siloed systems between HIV, TB, and malaria present a clear obstacle to maximizing people-centric integrated health systems. The existence of parallel systems with overlapping mandates, low levels of coordination, and poor efficiency are an obstacle to patients, and they limit the capacities of the system to respond rapidly to emerging threats. From the COVID-19 pandemic, we can see that integration of critical and supportive services, such as the integrated specimen referral network, for example, in Uganda, had enormously positive impacts on the capability of the system to respond rapidly to surges in demand for testing. So considering these factors, countries are strongly encouraged to leverage the tools, techniques, and best practices enabling integrated laboratory systems, one of which is DNO, or Diagnostic Network Optimization. DNO provides the key insights to deliver upon systems-level integrated service delivery. As a valuable tool to advancing systems, DNO primarily works to empower and activate lab leaders. For integration to succeed in practice, we rely entirely on those who may enable integrated systems from the foundation up. There's no top-down approach or mandate dictated that will integrate services nearly as successfully as the effect of the Lab Directorate driving integration from the initial design of the laboratory network upwards. DNO positions the Lab Directorate as the driver of that integration by providing the key data, insights, tools, and centralized intelligence to inform what the future state of the system should look like. It enables planning and coordination of system resources, as well as supportive processes, where system resources are the integrated facilities, multi-testing analyzers, equipment, and personnel, and the supportive processes are specimen referral networks, test reporting, inventory management, and quality management. DNO supports decentralization of patient-centered service delivery by defining operational needs, the resource requirements, and the support to decentralized service delivery, improving accessibility, consistency, and quality of laboratory services. And finally, DNO unlocks the insights needed to encourage cost efficiencies, enabling uptake of novel contracting mechanisms like all-inclusive pricing to reduce the operating and procurement costs. Lab stakeholders will find that undertaking diagnostic network optimization and the insights it produces will enable rationalization of resource needs to be articulated and included in funding requests for diagnostic commodities and technical support being submitted to the Global Fund, as well as other partners. Recognizing the value of diagnostic network optimization as a tool, this year the Global Fund has updated the Modular Framework to include DNO as an eligible intervention, along with a number of supported activities. The Modular Framework Handbook is a guidance document that provides standard modules, interventions, and performance indicators to support in the development of funding requests to the Global Fund. It also provides indications on the classifying activities funded by the grants under these standard categories. The activities and interventions that are supported and explicitly mentioned in the Modular Framework Handbook are data collection and geospatial analysis of the integrated diagnostic network architecture, including molecular diagnostic platforms and for key endemic and epidemic pathogens, mapping and modeling networks, including assessments, optimization processes, and analyses to evaluate trade-offs in access, cost efficiency, and equity regarding placement of multi-disease equipment and platforms in integrated lab networks, pre-service and in-service training of key personnel on continuous management of the diagnostic network resources, including digitization of resources through web-based interfaces, training of laboratory staff on relevant novel diagnostic procedures to detect priority diseases, including cross-training in different testing methodologies, and assessment of existing laboratory capacities for antibiotic susceptibility testing of common bacteria. While these activities are quite broad, a number of sub-activities may also be included, and those filling funding requests to the Global Fund are encouraged to include activities beyond those in this list where relevant to diagnostic network optimization. The second document displayed on the screen is the RSSH Information Note, which outlines the key priorities and guidance for applicants seeking support from the Global Fund in RSSH. Guidance is provided to countries, encouraging alignment with the new strategic direction, the key factors of which are integrating national laboratory systems, strengthening national laboratory leadership and governance structures, encouraging proactive participation of the national laboratory directorates, and including investments to support pandemic preparedness. The main areas supported through the RSSH information note critically and explicitly mention specimen transport systems and diagnostic network optimization as a priority. The critical approaches that guide the strategic shift are listed in the annexes, which I'll be able to expand on at the end of the presentation. Empowering and activating lab leaders to advance integrated approaches necessarily involves ensuring good governance and long-term planning of the lab system strengthening, including but not limited to the NLSP, National Action Plans, and other operational plans. Those stakeholders that are involved in undertaking diagnostic network optimization or including it in their funding requests should make a few key considerations. First, that DNO is a continuous iterative process with activities preceding and following the analysis stage. In addition to the analysis of data, other complementary activities must be considered. The core activities at DNO, for instance, are shown in green on the screen. However, there's a few other activities that should be planned for. For example, building capacity to encourage network optimization as a continuous process, enabling a data culture in the Lab Directorate to encourage ownership of resources, developing some of the data infrastructure, data warehouses, and monitoring tools, and continuously monitoring system performance through data collection. There's also a need to avoid over-reliance on external technical assistance to undertake analysis. Lab directorates should consider investing in the capacities to independently monitor system performance, continuously gathering data and updating those scenarios included in diagnostic network optimization, all of which relies on investments in training and capacity building. Given that diagnostic network optimization is a continuous process, those planning analysis are encouraged to consider their support and resourcing needs over the long term. For instance, Global Fund's funding cycles are 3 years. While all of the activities displayed in the timeline on screen are eligible for Global Fund support, securing financial support for all of these activities must be evaluated against other strategic priorities defined by the country and then prioritized in the funding request. DNO should be considered on a scale longer than the Global Fund funding cycle, and it should leverage the resources beyond those available through Global Fund grants, mobilizing domestic resources, the support from partners, as well as the private and non-state sectors. In planning DNO, countries should evaluate which activities have vital dependencies, where funding may be a barrier to continued activities, and to define the resources and the needs that are going to be budgeted. For instance, the operationalization of a scenario and relies on the completion of operational planning. Operational planning relies on the completion of scenario development. Continued scenario development relies on data science training and data infrastructure development within the country. As there are dependencies between each of these activities and work streams, we encourage countries to consider each of these work streams and the challenges that not securing funding for each of those work streams would impose on the outputs of DNO. Finally, DNO must be responsive to the changing resources, priorities, accessibility, dynamics, disease burden, and a multitude of other factors and realities within countries. I'd like to reiterate a few key recommendations to those planning DNO to wind down. First, stakeholders should seek early engagement with other key stakeholders to align on the scope, objectives, and expected outputs of DNO analysis. They should consider the key activities required to achieve DNO analysis and the resource needs for supportive activities to maximize the benefits of DNO. And finally, to align on the funding, resource, and support needs, considering the various available funding streams and support partners. I'll end by noting that integrated services between diseases is not something that happens overnight. There is an inevitability of a patchwork of solutions within countries sewn together somewhat haphazardly as countries navigate the complexities of transitioning from siloed to integrated services. However, DNO, as a core design activity and a tool available to us, eases that transition, providing a data-driven, evidence-based foundation upon which to build other integrated solutions. I encourage everyone online to refer to Global Fund's information resources that are available, the RSSH Information Note, as I had shown earlier, the Modular Framework, our Global Fund Strategy 2023 to 2028, the various technical briefs, and global guidelines. Thank you very much.
Thank you very much, Patrick, for outlining the process. And colleagues, keep the questions and comments coming through in the chat. We will respond to them at the end of the second presentation. Now we would like to move on to the second presentation. And I would like to ask Mrs. Nina. Nina, please, you need to use the French channel when you are speaking, and those that are would like to listen to the English language should remain on the English channel. Nina, are you there? Please go ahead and share your screen and take us through.
Okay. Merci beaucoup, Anafi.
Thank you very much, Anafi. And good evening, everyone. My name is Nina Mbenga Roquette, and I am the focal point for tuberculosis at the national level, and I would like to share the experience of Gabon regarding the optimization for the diagnostic of COVID-19. As you know, the coronavirus COVID-19 was declared a public health emergency of international concern by WHO on 30 January 2020, and in Gabon, we were also hit by COVID-19, and the first case was in Libreville, our capital city, on 12 March 2020 by the interdisciplinary laboratory of Franceville, which was a laboratory used for the screening of COVID-19, who was trained by Africa CDC and WHO. Facing this situation, the government of Gabon put in place a steering committee for the response. We called it COPIL, C-O-P-I-L. And you had the laboratory subcommittee that was charged to ensure coordination of laboratories for COVID-19 testing. Next slide, please. Next slide, please. Yes. So regarding the strategy adopted by the country, well, we needed to know if it was possible for Gabon to use the GeneXpert platforms for screening of COVID-19. And thereafter, we adopted two principal approaches. The first one, setting up of new laboratories equipped for RT-PCR testing. And the second approach was pooling existing facilities. And regarding the second one, it enabled us to put in place a great laboratory, Professor Daniel Gahouma, based in Libreville, which has a capacity of 10,000 tests a day. And you can see that most of the tests were done at this laboratory based in Libreville, and otherwise in sub-regions, as you can see, other laboratories, regional laboratories also tested, but other laboratories were not able to test, only regional and the national laboratory. Next slide, please. Next slide, please. So regarding these different strategies, we had some challenges at the central level regarding RT-PCR platforms. There were difficulties in transporting samples from the regions to the big laboratory in Libreville. And regarding regional level, the challenge was linked to the fact that most of regional laboratories didn't have, or there was insufficient auxiliary equipment, extraction equipment, freezer, microbiological safety sessions, etc. So it was an also complex method and untrained staff for RT-PCR. That was also another challenge. And the advantage for GeneXpert or for the RT-PCR platform is that the benefits were that we were able to do high volume of tests, 96 tests daily with equipment. However, for GeneXpert platform, well, the benefits is that you had a closed past platform, less difficult to handle, easier to use, less biosecurity measures, and we already had staff that was already trained and that just needed a refresher training for Express SARS-CoV-2 test. So the GeneXpert was found to be a good solution for scaling up COVID-19 testing in the regions. Next slide, please. Next slide, please. Thank you. Regarding the extension plan or scaling up plan for the GeneXpert in our labs, we needed to draft a scaling up plan, and this plan was drafted. Slide, please.
Slide, nothing.
So this slide was drafted with our partners, so Africa CDC and couple coronavirus, and also our partners, WHO, and it was, and also through the projects such as Resolve, Search COVID-19 testing, and Step Up, financed or funded by WHO. Next slide, please. Thank you. Here you see the mapping of GeneXpert, and we've done this based on data available in our country. So we knew where the laboratories were and the technical platform, which is GeneXpert in Libreville, and GeneXpert or DGeneXpert in our what was available in 2020 in the country. And we also had, if you remember, staff that we trained and that just needed a refresher. Next slide, please. Thank you. This data, we also used it to do a calculation of available capacity for COVID-19 screening within the GeneXpert laboratory network. So for each site, number of tests performed, for example, and also at national level, and we obtained an average, at national average of 50%. Next slide. Please. Thank you. Regarding activation of GeneXpert sites, so GeneXpert site control was done from the tuberculosis program, so it enabled us to have an inventory of the GeneXpert sites already completed by TB program. So to know, for example, what was the infrastructure, the existing infrastructure, and the staff available. So it enabled us also to use the standard operational procedure of development of expert and express SARS-CoV-2 test and SOPs, installation and configuration of the test software on site, user training on sampling and performing the express SARS-CoV-2 test with practical skills assessment and test verification, non-positive and negative sample at our reference national laboratory and at each site regarding the non-positive and negative samples. Next slide, please. We also did an upgrading of human resources. So first, training of national trainer by CEFIT. We trained 6 person regarding our express SARS-CoV-2 test and networks, and also the laboratory Pascal laboratory user training for express SARS-CoV-2, so 20 staff and on-site cascade training on activation by national trainers, and it was done for 10 sites between February and March 2021. Next slide, please. Next slide. No, that's good. That's good. Thank you. So as to procurement, we could now quantify and see what we needed for equipment, and we obtained funds from C19RM from the Global Funds, and we could buy some machines, 6850 Express SARS-CoV-2 cartridges, and purchase of 2 additional GeneXpert machines, 16 modules and 4 models. We also got support from WHO, and we were able to purchase 3,550 cartridges and for Express and SARS-CoV-2. And these various tests were done in the activated site, giving the priority to sites in entry portals and in regions where we did not have a platform RT-PCR. Next slide, please. Regarding monitoring of sites, all labs were evaluated regarding the international EEQ, One World Accuracy, and we have here a board that enables us to do a follow-up of these activities. Next slide, please. Next, thank you. Here you can see on this slide the contribution of GeneXpert sites to COVID-19 screening, and it was quite an interesting and important contribution as we had an increased usage rate after GeneXpert activation. So the lesson learned is that the integration of COVID-19 wasn't done and it's not that we tested less tuberculosis. It wasn't the case at all. There was a continuity of TB services, and I thank you for your kind attention. That's all for me.
Next slide, please.
Next slide, please. Thank you. That's the thank you slide. Thank you for your kind attention. I'm done with my presentation.
Thank you very much, Ms. Nina, for the wonderful presentation. Colleagues, we are now getting into the question and answer segment. I can see already some of the questions have already started coming through in the chat. So let's get going. Maybe we start with, thanks, Patrick. Already, I see you have already started responding to some of the questions in there. I think the first question is, can the development of EDL be considered under this DNO funding that is available? I know you have responded them in the chat, but there are some that may be having a challenge in really accessing the chat. So I'll kindly ask you to respond to that question. And also you can combine it with the one on HR distribution across the network, whether this is also one area which is eligible in this area.
Thank you very much. Yeah, thanks for the question. So the modular framework does outline a large number of different interventions and activities that are eligible for Global Fund funding. The essential diagnostics list is counted as development of the essential diagnostics list is counted as an eligible intervention under policy, strategy, and governance within RSSH Health Products Management System. So the phrasing specifically is development or update of the essential medicines list, essential diagnostic list, national drug formularies, and standard treatment guidelines and consolidated testing guidelines. So this is within the scope of intervention package for policy, strategy, and governance, and includes the technical assistance to support that activity. Similarly, human resources for health it exists in various different places within the modular framework as an eligible intervention. Human resources for health planning, management, and governance, including for community health workers. Education and production of new health workers, excluding community health workers, and remuneration and deployment of existing and new staff are all funded activities. So you'll find those on pages 22 to 30 of the modular framework handbook that is linked. I'll also be providing the slides after the session so that you can access all of those documents that were linked within the slides.
Thank you very much, Patrick, for that. I think moving on to the next question, I think it's about who are the key stakeholders that need to be included when it comes to the process of applying for funding and getting for funding. And we have a comment or question that is just saying the Directorate of Labs are the lead in getting the data on lab networks, but sometimes we also have the National Public Health Labs that would also be interested in the elements of surveillance. So it is important that we have that engagement for as much as possible throughout the operationalization. Maybe I can ask you to comment on the issue of stakeholders when it comes to considerations and application of funding.
Sure, thank you. So the Global Fund funding cycle and application process is managed at each country level through the country coordinating mechanism, the CCM. There are national committees that submit funding applications to the Global Fund and oversee grants on behalf of their countries. The CCM includes representatives of all sectors involved in the response to the diseases, so academic institutions, civil society, faith-based organizations, governmental, multilateral, and bilateral agencies, non-governmental organizations, people living with the diseases, the private sector, and some technical agencies. Their function is to coordinate the development of the national request for funding. They nominate the principal recipient, so the agency or organization that receives funding and manages it. They oversee the implementation of approved grants and approve any of the reprogramming requests. And they ensure the linkages and consistency between Global Fund grants and other national health and development programs. The country coordinating mechanism may include the stakeholders from the National Public Health Laboratory, the National Reference Laboratory, the Lab Directorate, or the National Technical Working Group for Labs. Stakeholders from any of those agencies are encouraged to engage directly with the country coordinating mechanism and make efforts to involve themselves in the funding request and development of the funding request, articulating the priority needs of the Lab Directorate, articulating the needs indicated in the National Laboratory Strategic Plan, and clearly budgeting those activities so they may be included in funding requests to the Global Fund. Information on the country coordinating mechanism is available on the Global Fund website if you Google Country Coordinating Mechanism Global Fund, or I'll paste the link in the chat as well.
Great. Thanks a lot. It is important to get that. And I see David is already asking, how can we get that information? So I'm hoping we can maybe paste that link into the chat before we leave, particularly regarding the CCMs. I find this question also interesting in terms of scope of the support. Normally people hear it's called the Global Fund for HIV, TB, and Malaria. Does it mean these support systems only support these diseases, or can we go beyond these three?
So the nature of Global Fund's support to countries is that our agency is primarily tasked to distribute funding to respond to HIV, TB, malaria. However, lab system strengthening is not simply isolated to responding to HIV, tuberculosis, and malaria. And so this verticalized funding, then paired with verticalized pillars of disease response in countries, tends to leave other diseases and priority diseases behind. Countries' stakeholders involved in developing funding requests should consider how those investments and the investments that they prioritize can positively impact the infrastructure towards responding to other priority diseases. Countries that don't have a priority disease list or an essential diagnostic list should invest in those policy and governance structures in order to ensure that the system responds effectively beyond HIV, TB, malaria. And the essence of integration is that we integrate at the top level HIV, TB, malaria, as they are highly funded, but we also include other priority diseases. As the infrastructure remains the same, the methods of response to diseases remains the same, a lot of the needs in the country essentially remains the same. And so in essence, we do not solely focus on HIV, TB, malaria.
Great. Thank you very much. So let me just switch on the gear a bit, also along the same line, because Nina presented on TB. So I'm trying to get who this one is, who says, hello, everyone. Is your DNO only for COVID-19? How about HIV and TB integration? Nina, maybe you could explain the rationale of the Gabonese experience. Nina, are you there?
Oui. Oui, merci beaucoup.
Yes, thank you very much. So for the DNO in Gabon, it's not only for tuberculosis. We also have the viral charge and also HIV screening in Gabon. Over to you.
Great. Thanks, Nina, for confirming that this is not only for disease specific, but it goes beyond. And I would like to also call upon other experts that are in here on the line to indicate that I think it's a matter of I think Patrick had shown a flowchart where people are really getting all the stakeholders, identifying the scope of the DNO that they need to do. I think it is at that point that people really have to really make sure that this comes up and clearly laid out exactly in terms of what are we intending to do right now with this DNO. And I'm hoping this is just the second session of this sub-community of practice we hope we could actually go into the technicalities of what exactly happens and how we reach some of these decisions moving forward. What we are picking here is certainly this should go beyond HIV, TB, and malaria, but these three are mostly to do with this is actually because most of the funding is actually coming through these three channels. We would like to actually follow on that area as well. And this is a question that says, now that cases for COVID-19 are going down and capacity has been improved, do you expect the output of TB, do you expect an increased output of TB testing? I think they are coming from the issue that you had to ride on TB and COVID-19.
To who do you address this question?
To Nina.
Okay. Okay, merci.
Thank you. Yes, I'm not sure if I am the one to respond to this question, but what I know is that in the recent TB report of WHO, Gabon has 527 cases and a lower number, 504 per 1,000 persons. So I believe that it shouldn't be the case regarding the last indices or indicators mentioned in this report. Thank you. Back over to you.
Thank you very much. I want to go back to the issue of stakeholders and the issue of advocacy. And this keeps on coming many times, including in today's session as well. And I want to pick this using a comment from Grace. Greetings, Grace, in South Sudan, Grace Lesu. Grace says the GF, the Global Fund, should advocate for lab representatives to be included in the CCM. Otherwise, we'll keep seeing key lab priorities neglected over time and lab systems lagging behind. And this is, I think, in support of many of other key activities, key comments that came through, such as how can we ensure that GF can support lab directors' engagement with the CCM. This is from one of the participants. So the key issue here is, whichever way, how can we ensure that the lab is engaged with the CCM? Let me stop there and then let you, I think, chip in, Patrick, or anyone else online.
Thank you very much. Let me just, sorry, I'll send over the slides afterwards, but the information note from the RSSH information note does explicitly request that country coordinating mechanisms and advise country coordinating mechanisms to include lab directors, lab directorates, technical working groups in the country dialogue. It's quite clear that failure to integrate failure to use lab directorates and the resources they have available, the expertise they have available, and representing that expertise at a key decision-making table limits our ability to effectively respond to diseases. The lab directorates, on the other hand, should make every effort to advocate for themselves as well, to be joining these key stakeholder meetings, either at the Ministry of Health or through directly to the country coordinating mechanism. And guidance on this is specifically detailed in the two information notes that I've shared.
Great. Thank you. Thank you very much for touching that. I think it remains a key important subject in terms of how do we really get our priorities there. There is also the role of the community. I think there was a question that the community should play an active role in identifying priorities. Trying to scroll down, I can't really quickly see it. But what role, this is from Nisifa to Lay, the community should lead, although we need to engage also on other issues on demand creation and sustainability. How can we engage the community ourselves as the lab to really push for some of these priorities that are coming from the lab itself? It remains an important question. Do we see the role of the community coming through? I know maybe this is not directly related to your presentation, but I just wanted to get a good sense of your thoughts, Patrick, when it comes to such.
So I think this relates quite closely to community human resources and human resources for health. While the funding for lab systems remains quite discrete, the work streams are quite discrete, there are critical relationships with human resources for health. And so while there may not be a strict avenue towards engaging human resources for health at the community level directly into the laboratory system, there are opportunities to leverage some of the resources available. That may be in specimen referral and sample transport, or the engagement of riders to support the hub and spoke model. So we don't explicitly call out what those interventions and activities might look like in the modular framework. However, we encourage countries to consider how the interlinkages and interdependencies between each of these work streams and how community systems may support the lab system.
Great. I know we are almost towards the end, but there are quite still a number of questions. Nina, I would like to actually direct this one to you from Nadine, who wants to know how you have managed to integrate sample transportation in your as you optimize your diagnostic network.
Alors, oui, merci.
Thank you for this question. Regarding this question, yes, we used some transport company to ensure sample transportation from one region to another, and otherwise we also used the public transport, different structures, and for laboratories, and thanks to the WHO funding, these transports could be used and paid for each time. It's we definitely drafted a circuit, I would say, of transport, a whole structure, and we put it in place indeed.
Great. Thank you, Nina, for the response. As we move towards the end of the session, let me ask you, Nina, in about 30 seconds to kind of give your parting words and how other countries can learn from what you have done in Gabon.
Alors, le mot de la fin, ce que je peux dire.
Conclusion. Well, I can say that scaling up that we've done in Gabon requires all parties to be involved, government and other partners that supported us, and you need to put in place the different guidelines and also a scaling up plan that can be submitted to various partners so that we can finance this implementation. This is what I would say to other countries. This is what you need to do, and I encourage you to adopt the same strategy.
Great. Thank you, Nina. let me switch over to Patrick. Can you summarize a few key takeaway points from today's session?
Of course, thank you. I think I'll reiterate the last point that I made. Integrated service delivery between diseases is not an easy target. There's no one single avenue or intervention or activity that can lead exclusively to integrated services. It requires a confluence of effort from various stakeholders and a great deal of alignment. The patchwork solutions that exist in countries are often going to be pushed together, and there will be some frictions. But the complexities of transitioning from silo to integrated services are worth it in the end, considering the gains that can be made as a result. DNO as a core design activity can ease that transition. It can provide data-driven evidence-based foundations upon which to work, and it can inform future activities and future strategies. And so we encourage countries to undertake this critical exercise in order to inform their funding requests and their future strategies. Thank you very much for having me. I really appreciate it.
Thank you very much, Patrick and Nina. Indeed, DNO is one of those key critical interventions that we can actually undertake as countries. And the most important thing is we do have avenues where such activities can be funded. For example, today we have outlined how DNO funding opportunities are available from the Global Fund. We also have other streams of mechanisms that we are aware of from PEPFAR, from UNITAID, from our governments. What is important is to really ensure that these principles are taken. We acknowledge that resources are minimal, and hence DNO comes in to kind of close that gap. And this is one of those rationales of introducing this sub-community of practice. ASLM and FIND feel this is one key area that we need to continue working together. As a result, we would like to, as a result, we would like to continue inviting you to future sessions that will go into many of the issues that have been tackled today. Certainly issues like community involvement has been key and play a role. I hope one day we will be able to look at this. Till we meet again, thank you and goodbye.